the situation of depression. World Health Organization reported that the population of patients with depression will be ranked second in the world after cardiovascular disease in 2020. And 10% of the world population will suffer from mental health problems that can affect their quality of life, the cost of healthcare in patients' family, community, and nation. In Thailand, Director of Mental Health Department said that about 5% or 3 million people in Thailand suffer from depression, although it can be easily treated by taking a medicine. Most of patients verify a mental health provider or psychiatrist. What is the definition of depression? Depression or major depressive disorder is a mental disorder. Patients with depression can feel very sad, unhappy, hopeless, and depressed. Most of them don't want to live. Depressive symptoms can affect their life, mood, behavior, and health. For example, there will lack of interest in doing some activity such as eating, working, studying, and playing with friends.
What are causes of depression? Depression is a very complicated disease that we didn't know the real causes of it. In general, depression is usually caused by multiple factors. There are three main factors that may involve causes of depression. Firstly, change in the brain is due to decreasing or increasing in some neurotransmitter in the brain such as serotonin, noradrenaline, and dopamine. It is also called chemical imbalance, which can affect the patient's brain to regulate their mood. Secondly, personal factors are associated with depression. For genetic, people with family history of depression are likely to have higher risk than people without family history. However, other personal factors also have a big impact on depression, such as using some medication and alcohol, severe illness like cancer, and patient's personality. Low self-esteem people who are very sensitive to the negative comments are prone to develop depression easily. Lastly, I'm going to talk about very important factor that may cause depression: life condition. Researchers found that people who undergo long-term distress, for example, continuing jobless and prolonging seclusion, can lead to depression. Besides, these also include bad experiences in their life, such as losing precious things or beloved one.
Signs and symptoms of depression. It can be difficult to understand depression because it's a disorder defined by thought, beliefs, and feeling rather than an obvious symptom such as back pain or vomit. However, there are some common signs and symptoms to help you figure it out. I'll give you 10 of them. Sign number 1, feeling of helplessness and hopelessness or pessimism. Sign number 2, loss of interest in most or all activities that used to be pleasurable. Sign number 3, sleep changes including insomnia or excessive sleeping. Sign number 4, low of temperature or feeling agitated easily. Sign number 5, loss of appetite or overeating. Sign number 6, loss of energy, feeling fatigued, and even a small task taken extra effort. Sign number 7, recurrent thoughts of death or suicide attempts. Sign number 8, reckless behavior such as reckless driving or playing dangerous sports. Sign number 9, difficulties concentrating, trouble making decisions, or remembering things. Sign number 10, unexplained physical problems or persistent aches or pains that do not cure even with treatment. If you have been experiencing most of these following signs and symptoms, you may be suffering from depression. However, depression is something that we can fight through. There are a lot of help to manage your symptoms.
How to treat and prevent depression. Depression can be treated by using medicine, visiting a psychologist, and changing lifestyle. Although it has many ways to treat this disorder, the best and simplest way is lifestyle modification. It can provide great and beneficial outcomes by spending less time and money. Change of lifestyle. Without medications, we have many ways to help you, such as exercise, healthy diet, sleep, social support, and stress reduction. Let me get into details with the first issue. Exercise. It can stimulate neurotransmitter in brain called endorphin, serotonin, and other beneficial chemicals in brain, making you feel better, like taking antidepressant drugs. It's not necessary to exercise every day. Even a half hour of daily walk or 30 to 60 minutes of aerobics per day can bring a big difference. Nutrition is also important. You should consume healthy diet because it can affect your physical and mental health. Carbohydrates are associated to the mood-boosting brain chemical, serotonin. By the way, you should choose complex carbs such as whole grains or fruits rather than simple carbs such as cookies. Next, getting enough sleep. You should sleep at least 8 to 10 hours per night. Sleep is the most important way to relieve depression. Lack of sleep is a cause of body system illness and can make depression worse. Stress reduction. When you feel stressed, you should try to be optimistic. You may listen to music, read your favorite books, and do something new, such as begin a volunteer or taking a language class. Overall, if you try to use this way to treat and don't get better, you should consult a psychiatrist for right treatment.
What is the importance of family to patients with depression? We have known that depression is a serious disorder, but it can be treated. Although medical treatment or lifestyle modification is used for treatment, it would be better with family support. So it is necessary for family to understand how to support their member with depression. There are many ways that family can take to encourage their patients. Today, I would like to bring up 3 topics that family should be recognized, which are learning the symptoms of depression, way to speak with the patients, and preventing suicide. Family should start by learning the symptoms of depression. It is better to explain depression in medical condition with the patients, because many of them may think that it is a normal condition or personal weakness. When the signs of depression appear, family should suggest the patient checking up with a medical doctor for getting right treatment on time. It is also important for family to learn how to talk with the patients. Sometimes it is hard to know what to say. The best thing that family can do is just ready to listen their feeling, so that their loneliness and isolation will be reduced. Don't try to solve the problems and give advice to the patients. Using language in encouragement and hope with them are enough. Lastly, when someone is depressed and shows a warning sign such as talking about suicide, family should be careful that it is very dangerous. If you think your family member might suicide, openly talk about suicide thought to them and take them to see mental health professional as soon as possible. You may feel uncomfortable to ask them about this topic, but it's the best way to save their life. Now we can see the importance of family to patients with depression. All humans need love and moral support from their beloved. Without unconditional love from family, it can be hard for the patients to engage with the patient alone.